The deadly Ebola virus is once again spreading rapidly and terrorizing residents in several African countries. The Democratic Republic of Congo is in particular peril. VOA traveled with U.S. health officials in mid-September to the epicenter of the outbreak along the country's remote northeast border. The U.S.-led delegation brought hope and medicine to the region, but serious challenges remain. VOA correspondent Arcega was on the trip and reports from DRC.
It's a journey few Westerners will make. Over rainforests and active volcanoes, past the winding, dusty roads leading to the remote village of Butembo. Here, elbow bumps replace handshakes. Shoes and hands are disinfected. Anyone who enters, checked for fever. This is U.S. Health and Human Services Secretary Alex Azar's first visit to the Ebola treatment center in Butembo, the front line in the battle to stop the deadly virus.
It's an incredibly tragic situation, especially to see the children. So many children. I think that probably was one of the things that struck me the most, were how many kids are here. But I also came away with more hope than I thought I would.
The outbreak began last year. It's now the second worst ever. More than 3,000 people infected, more than 2,000 dead. But there is hope for a cure. The development of 2 new drugs synthesized from the blood of an Ebola-resistant patient.
You know, it's a game changer. I mean, it's a game changer.
Dr. Anthony Fauci was part of the team that helped develop the new drugs. Not a cure exactly, but extremely effective.
When you say a cure, it's almost as if everybody who gets it is now going to be okay. There's still going to be people who come in so advanced that no drug is going to help them. But clearly, if you get one or the other of these 2 drugs, you dramatically diminish the mortality of Ebola.
But cultural mistrust is common here. Some believe Ebola is not a virus, but a man-made poison.
The misguided perception of Ebola treatment centers in the past has been that sick people would walk into these centers and they would ultimately leave either in a body bag or in a coffin. But there's a lot of people in this community working hard to change that perception.
Among them, Mulyanza Huguet. The young woman made a full recovery after receiving the experimental drug monoclonal antibody 114. Today, she goes from village to village, urging families to seek early treatment. Another serious challenge is security. More than 100 warring factions vie for dominance along the porous eastern borders of the Congo. In this part of the world, protecting health workers is a full-time job.
Thousands of security incidents, and anytime you have disruption in your intervention, of course, the virus will replicate, and you have to catch up. So it's taking a lot of energy and time.
The United States has already invested over $300 million to develop anti-Ebola vaccines and treatments. Secretary Azar hopes his visit demonstrates America's commitment to the region.
If it helps reinforce the fact that we were in this before the first Ebola case and we're going to be there after the last Ebola case, and it's a part of a community effort and community engagement, well then I'm delighted if it had any impact.
Arcega, VOA News in Butembo, DRC.